The Laser Touch 1 is a revolutionary new technology that puts pain relief in the palm of your hand. This breakthrough product is currently the only device available that combines low-level laser therapy and microcurrent electrical stimulation. We've seen how effective the Laser Touch 1 can be for pain relief after only a single 4-minute treatment. But is it reliable enough for medical professionals who work with real-world patients every day? Well, for chiropractors, physical therapists, and massage therapists, the Laser Touch 1 is revolutionizing the way they approach healing.
Kenneth Perkins, CEO, physical therapist. The good thing about using the Laser Touch 1, it proves itself in a very short time. You don't have to say, let's do this and then come back and let me know what's going on. You can sit in a clinic, 10 people can come up. 9 out of the 10 people will stand up and look at the audience and say, the darn thing worked. In cases where nothing has worked before, or if they've had very limited success with other types of therapies or medications. So it is new as an idea, but I think it's the next step in what's happening in healthcare.
Well, we work with a variety of sports. We have 22 varsity sports here, so we work with everything from soccer to hockey to wrestling to baseball, softball, lacrosse, and on and on. And we see a lot of athletes that have many overuse types of injuries, tendinosis problems, just inflammatory conditions. And oftentimes they'll come in complaining of pain and discomfort in those areas, whether it's lower leg, knee, hip, shoulder, and we will evaluate them, assess their problems. And oftentimes with the chronic situations, we find that treating them with any anti-inflammatory type of modality that we can find to use on them, pretty effective. And we've really enjoyed using the cold laser because it has shown anecdotally in a lot of cases where nothing else seems to have touched their pain. And if we use this, it seems to reduce that over time, and they seem to really enjoy it.
I'm very skeptical of any of those type of products. In our office, we are completely hands-on. I, as a licensed massage therapist, believe in human touch for healing. So I am the biggest skeptic here because obviously it was something that no way I would have ever tried, because it's a laser. I mean, how's that going to help? But what I did find, and what I know as a therapist now, as that laser is used on a knot in a muscle, that buildup of lactic acid, as that's used, it melts it down. So as a therapist, I can feel that muscle immediately. There's no warming it up. It's immediate. And that's after 2 minutes. So I can't say enough about it. I really can't. And for me to have one in my home, no, it would have never happened.
I believe the combination of the electric muscle stim and the laser therapy is important. When it comes to lasers, not many people know about it or how it works. And I tell my patients, well, it's a lot like acupuncture, where we're stimulating the cells, on a cellular level to promote healing. And essentially, yes, it is nothing like nothing else, but it works. That's what I can say.
I'm a physical therapist, and I work in a pediatric setting now. I'm actually a practice owner, so I own a private practice. And I've been doing pediatrics for the last 12 years and have been a physical therapist for 17 years. The Laser Touch 1, I was introduced at a Black Bear medical conference, and was honestly first skeptical about it because it gets great results, and when you first hear that, you're a little skeptical. But I tried it. I actually tried it at the course, and I happened to wake up with a stiff neck that morning, and used it for 2 minutes on my neck, and the pain was gone.
So that's what's amazing about it. It's a fun way to promote therapy when you also are learning how effective it can be. So we found that particularly the neck seems to be really great. Low back strain, low back pain, that's been dramatic as well. We've had some people come in, they've been in pain for over 10 years, and in a 4-minute session, they'll stand up and say, this can't be true. I'm feeling better already. So that's why it's a fun machine to work with, But it proves itself every day. Every time you use it, something tends to happen in the positive.
It is convenient. We actually have, I believe I'm up to 4 patients now who I've treated with the laser and have come back in and go, can I buy that? And where can I buy that? So of course I direct them to where, you know. So they've bought one for home use and using it quite frequently.
You know, initially there's an investment of buying it. Not everyone can put that money out, but that investment over time will pay off so quickly because you're going to stop taking the Advil, you're going to stop taking the Aleve, you're going to stop taking all those pain meds, and guess what? In 2 minutes you're going to have relief. You're not going to have to wait a half hour for the meds to work. And why ingest when something like this can be done with less harm? There's no harm to the product.
I think the Laser Touch 1 is going to become standard in physical therapy clinics, just like ultrasound is and electrical stimulation. I think it will be a standard modality that's used in physical therapy practices, and also something that's prescribed for home use as well.
Sometimes they'll come in with pain of level 8. Very often they're down to a level 3 in one treatment. Sometimes after a couple treatments I can actually get them down to a 0. Now that seems like that's impossible. So that's why I'm leaving that out there, because go in and try it, because that's how powerful this machine is.
I say try it, see if it works. It's like anything else, you know, some therapies and some methods work for some people and some for others. So why not try it out? It's safe, it's effective. It doesn't take very long. That's the beauty of it. In this go-go world, people don't want to sit down with an ice pack for 20 minutes or a half an hour. This they can apply for 2 minutes, 4 minutes, and they're done. They're back to doing what they do, which is a real advantage when it comes to this type of therapy. It's extremely beneficial to my practice, and I'm just glad it's another tool for me to help patients become pain-free.
Well, honestly, I haven't used it on myself. The Laser One Touch it seems to be effective, and it's like anything else that athletic trainers, they never treat themselves. They're always treating everyone else. So we're the worst patients, but it's been effective for me and a lot of our different patients. And you know, we've only had it for a year, but so far what we've seen with the Laser One Touch has been really, you know, tremendous and a real positive approach to our repertoire of treatments.
If you're skeptical about the Laser Touch 1, you need to try it. And you need to try it and see what happens, and you'll be happily surprised.
Whether in your doctor's office or now in the privacy of your own home, the Laser Touch 1 is relieving chronic back pain, stiff necks and shoulders, hip, knee and foot pain, pain associated with carpal tunnel, plantar fasciitis, tennis and golf elbow, even sciatica and arthritis, and much more. If you've lived with debilitating pain, if you are out of options, the Laser Touch 1 is a chance to reclaim your life. When we return, we'll talk with patients who have been using the Laser Touch 1 over a longer period of time. Now, if a single treatment can make a significant change in a person's life, what happens when they take the Laser Touch 1 home? That's coming up next.
I got the opportunity to use it for a week. And I also have a sore hip and I have a sore knee. So I tried all 3, and all 3 felt better. And each day it continued to be better. So that made me feel pretty good about it.